Hello and thank you for joining us. I'm Aaliyah Flores and welcome to In Good Health with McLaren Macomb. On today's show, we'll be talking with orthopedic surgeon Dr. Christopher Nicholas. He will be telling us if the pain in our knee is something to be worried about. Then we'll be heading out to see physical therapist Louise Bommarito and learn some ways to stay in shape over the winter months. But first, we're joined by Dr. Blair DeYoung, a cardiologist with McLaren Macomb, and he is here to tell us about how to combat heart disease. Welcome, Dr. DeYoung. Could you just share with us a little bit about your background?
Sure. I'm an interventional cardiologist at McLaren Macomb. I have been in practice for 8 years. I went to medical school at Michigan State, and I do a lot of procedures in the cardiac catheterization lab at McLaren Macomb.
Okay, sounds good. So as we know, heart disease is the #1 killer here in the country, and as well as Macomb County. Could you just share with us some of the symptoms of heart disease?
Well, the classic symptom of heart disease or heart attack is chest pain, what we call angina, which is low blood flow to the heart. But also you can have symptoms of shortness of breath, dizziness, indescript pain. Women and the elderly and diabetics tend to have atypical symptoms, meaning not the normal chest discomfort. So they can be a little harder to diagnose.
Okay. And how can these symptoms or how can they be treated now? What kind of procedures are being used currently?
Well, we have medication, and that's usually first line for angina and heart disease. Okay. But we also have procedures, cardiac catheterization, stents, open heart surgery, which is the traditional method. But as time goes on and techniques become more day-to-day practice where we do complex interventions, stenting is becoming more popular.
Okay. So I know that lifestyle attributes to heart disease, and according to the American Heart Association, heart disease is preventable for most people. Could you just share with us some of the changes that we might need to make to our lifestyle so that we will not be more advantageous to have heart disease?
Sure. I mean, a healthy diet is most important.
Okay.
Exercise. We do have a major problem with obesity or patients being overweight, especially in Macomb County. So diet and exercise are #1. There are other things we can modify, such as tobacco abuse. But just overall living a healthy lifestyle is important.
Are your patients very compliant?
For the most part, yes.
Okay, so they do listen to you when you're telling them all these signs and symptoms. Okay, so we also know that patients living with heart disease experience total occlusion. Could you just share with us what this procedure is like and what the physical symptoms are?
Sure. Chronic total occlusions are heart blood vessels that have been blocked for more than 3 months. And these cause a lot of symptoms for patients. They're usually patients who have had chronic heart disease. They've had prior bypass surgery, prior interventions. They just have arteries that we commonly refer to as arteries having natural bypasses. They're difficult to treat. They were usually treated with medications, but patients still had significant symptoms even though they were on medications.
Okay.
Now we have newer procedures to open these blood vessels.
Okay, so it sounds like this is a pretty minimally invasive procedure.
Yes.
And kind of with a tremendous upside as well for the patients.
Correct.
Okay, so what are some of the benefits of this specific procedure compared to some of the traditional treatments available?
Like I said before, most of these patients have had chronic heart disease. Okay. They've had bypasses in the past. To have a second bypass is almost prohibitive at times. Sometimes they just have one artery that's been blocked, and like I said, they were treated with medications. Now we have newer procedures, which is the traditional angioplasty and stenting, but we have new guide wires, new devices to cross these blockages. The success rate with these blockages used to be about 50%. Now we're in the 90% rate. Okay. We have a very good success rate at McLaren Macomb. We're almost 100%, which is fantastic. A lot of these patients have chronic shortness of breath, and they get marked improvement after you fix these blood vessels.
So when your patients are coming to see you and they've experienced certain signs and symptoms, would you say they're catching it at a good time before any type of problems further down the road happen or occur?
Sure. Heart disease presents in a lot of different ways. Some presents acutely through the emergency department, and we take care of it then with a primary angioplasty, which is for a heart attack. Some of these patients have chronic symptoms, and yet, yes, it does take some time for them to come in to see their cardiologist, who diagnoses them with either chronic angina or heart failure. The patients with chronic total occlusions, they tend to come from everywhere, and different subsets of physicians refer them. It's either their primary cardiologist, it may be a pulmonologist, because like I said, a lot of them have shortness of breath, so they do present in different ways. And they do have marked functional debility. I mean, they're not able to do what they used to do. So it may take some time, but for the most part, patients do present in a timely manner.
Okay. Well, we certainly appreciate you coming out today to share your viewpoints on heart disease with us, and thank you for your time today.
Great. Thank you very much.
For more information, visit mclaren.org/Macomb Heart.
And now we will head out to go see physical therapist Louise Bommarito.
Hi, I'm Louise Bommarito. I'm the manager of outpatient rehab services here at McLaren Macomb. I'm a physical therapist, and I've been with McLaren now for over 28 years, and I'm here today to talk to you about why it's so important to stay exercising in the winter months here in Michigan. Some of the benefits of exercise can help you control your weight. It also can help reduce the risk associated with cardiovascular disease and type 2 diabetes. It will also help strengthen your bones and improve muscle flexibility. 150 minutes of moderate exercise weekly improved brain health. And what that helped do is decrease the onset of dementia by as much as 8 years. 10 minutes of exercise can release the feel-good chemicals in the brain, serotonin and dopamine. What they help do is reduce anxiety and depression, as well as improve your overall well-being and your energy level. And the last thing exercise can help do is you can be a very good role model to other people in your life. Warming up is very important, and part of warming up is stretching. The importance of stretching will actually increase the flexibility for all the joints so that you can actually increase your range of motion. So an example, if we are stretching muscles across the shoulder and the thoracic spine, we can actually improve function, and you might be able to reach into the top shelf a little easier. Another reason for stretching is that you can actually lengthen tight muscles that lead to poor posture. So if you're tight and we stretch, we probably can improve your posture. Another reason for stretching is it warms up the muscles prior to an increased workload or an activity. You'll increase blood flow to those muscles before they actually work out a little bit harder. Something else stretching does is it actually can improve your balance as well as improve your activities of daily living. So that's really important for the older population. What I'm going to do now is demonstrate some stretching. What I recommend everyone do is do a series of these stretches prior to any of your workouts. So when we start at the top, I tell people to at least turn their heads from side to side, slowly, without pain. Again, 5 to 10 repetitions at the neck. Then what I would like someone to do is just start with some shoulder circles. You can roll your shoulders back, you can roll your shoulders forward, just to warm up the upper body, as well as some gentle arm circles forward and backward. If you have a balance issue, I recommend that you do hold a chair or something so that you don't lose your balance. You're going to put your foot up, you're going to keep your knees straight, and you're going to keep your back straight. Hold the chair if you need to, but if you don't, that works your balance. And I want you to lean forward. You should feel a gentle stretch on the back side of your leg. Again, don't bounce. You want to hold that for about a 30-second count. Feel that gentle stretch. And then what you're going to do is you're going to make sure you do both sides. Again, hold the chair if you need to. You should be able to get your heel close to your butt if you have good flexibility. You would hold that for 30 seconds. Again, if you don't have that type of flexibility, you can grab your pant leg and hold, or you could put a towel around your ankle and hold that as well. Now we want to work the side of the leg. It's called your IT band and also the lateral side of your trunk. You'll cross one leg over the other, hold a chair if you need to, and you're going to lean away from that side. What you want to do if you can, and you have good balance, you want to bring that arm up over your head so you can actually get a stretch up the side of your trunk as well. The last part of a stretch will be for the lower part of your leg or your calf muscle. Crosses your knee and your ankle. Some people will call this a runner's stretch. You'll put your foot back, your heel stays on the ground. You're going to lean forward, use your chair if you have one, or you can even put your hand on your leg. Your knee stays straight, and you're going to feel that stretch gently up the back side of your leg. Now we're going to have some fun with some circuit training. If you're young enough and think you can handle this type of routine, this is going to work overall body functions in functional positions. It gets your workout done in a little bit of a shorter period of time, but it is a little bit higher level. I like to consider this called a 5, 10, and 15 workout. What that means is you'll do 5 reps of one exercise, 10 reps of another exercise, 15 reps of a third exercise. You'll take a 10-second break. You'll do another circuit of 3 different exercises, and then you'll repeat that pattern. So the first one I want to do, again, do this if you can, it's a push-up. You're going to put your hands flat on the floor, put your feet straight out. You want to pull your abdominal muscles in, and then you want to bring your chest down to the floor, and then back up. So again, abdominals in, down to the floor, and back up. The next exercise can be a squat. You can take an exercise ball, put it against the wall, put your feet out, flat, arms are at your side, tummy stays tight, and then you're going to squat down. Pause, and come back up. You want to make sure your knees don't go past your toes. Another exercise that incorporates a lot of different muscles in the body is a simple jumping jack. And you're just going to spread your legs, arms overhead, keep your abdominals in, and you can do that 15 times. So that would be circuit 1. You'll take a 10-second rest. You can repeat those exercises a couple times, or you can do 3 different exercises for your second circuit. So for the second one, I'm going to demonstrate an exercise that you can do 5 reps of, and that's a lunge. And you're going to step out, knee again doesn't go past your toe, and step back. You'll alternate that. And again, you're going to do 5 reps on each leg. Head stays up, tummy stays tight. So that's a forward lunge. For the second circuit, the 10 repetitions could be a reverse curl. You could take your exercise ball, lay flat on the floor. You're going to put your legs up on the ball. Your hands stay flat on the floor. You're going to pull your abdominal muscles in. You're going to squeeze that ball with your legs and pull up. Pause. Bring the ball down. Again, you can do that 10 times. So that's your reverse curl. That's working your lower abdominals. The last exercise you could do for a 15-second hold, is a plank. You're going to put your arms flat on the floor. Elbows are going to stay over your shoulders. You're going to bring your legs out. You're going to on your toes, and you're going to make sure that your back comes down. You want to hold that plank position, again, for about 15 seconds. You don't want to be arched up, and you don't want to be swayed back. You want your back to be straight. So again, you're going to keep your tummy tight and hold that for 15 seconds. It's been a lot of fun sharing this information with you, and I hope you all have a very healthy and happy winter season here in Michigan.
For more information, visit mclaren.org/winterexercise.
Welcome back, and we're here with Dr. Christopher Nicholas. Welcome, Dr. Nicholas.
Thank you.
Dr. Nicholas, could you share with us a little bit of your background?
Well, I'm an orthopedic surgeon. I've been in practice for about 15 years. Okay. Kind of local as far as my training. I did my undergrad down at Wayne State and then my medical school training at Michigan State. and then my residency. So yeah, it just keeps going.
Okay.
So that's another 5 years of training, and that was somewhat local too, primarily in Pontiac, and then through some of the other hospitals in the area, primarily as part of a consortium with Michigan State.
Okay.
I started out in practice in a larger group, more over by Auburn Hills, and then more recently I've moved closer to home. I'm from Macomb County and coming home to my roots.
Well, welcome back.
Thank you.
So your area of expertise is joint replacement and knee replacement. Could you share with us, or with our viewers, some of the knee pain that require medical attention?
Sure. So, and that's a common question for patients, should I be seen? Is there something I can do? And I think the first part of that question is, are they making the right assumption, or is it just an assumption? Have they been diagnosed with arthritis, or is this something that they think that's what they are? And they may or may not be right. If you haven't had an actual confirmed diagnosis, and this is something that's been going on, it's not just there for a couple days, this is a real nuisance, it's affecting you, it's changing you, it's certainly appropriate that you see someone like myself or someone else to confirm, are you on the right track?
Okay.
It may be something else that we have other options for. If you do know it's arthritis, then it's a matter of how much is it affecting you? And again, it may be someone like myself that spends a lot of time looking at all the different options and being able to educate you about those, or look for solutions. And it doesn't mean surgery. Sometimes it does. There's a lot of other things that can be the right answer for you. And then again, that's where you need someone like me to talk with you.
So what would some of the solutions be before you actually had a surgery?
Sure. So in the case of joint replacements, what arthritis is, you're wearing out the joint. So it's going to be usually a gradual progression. So there's a lot of things that may be able to control your symptoms adequately for you without actually literally replacing that worn out joint. It may be the use of anti-inflammatories, there may be therapy, bracing, different types of injections, either steroids or there's other forms of injections now that can be very effective for people. So it's really kind of getting a baseline. Where are you at in the progression of this disease? What things have been attempted? What fits right for you? And it's not going to be the same answer for every patient. So that's where, again, that talking really comes in at first.
Okay, I understand that completely, being that I've had some knee surgeries in the past myself. How can one avoid knee surgery? I know sometimes when we get up in the morning, we'll hear a pop, maybe a lock here and there, and we might wait and just put ice on our knee for a little while, and then the pain is still there, and then we'll come and see an orthopedic surgeon. At what point does knee surgery kind of come into place?
So I think it depends a little bit on what the conclusion of what is the underlying source to your problem. So if it's something that's more structural in nature, a tear of a cartilage or something that's catching, flipping, causing that locking type of symptoms that you described, well, that's a physical problem that probably needs a physical answer to it. And then surgery may be something that we would discuss much earlier in the solutions for you. For a lot of people, whether it be arthritis or even other conditions, it may be causing inflammation, causing pain, but maybe one, it has an opportunity to heal. Or if we can control the symptoms right now through lesser means, maybe it isn't that problematic for you. So it's being educated and having the right assessment to figure out, is it safe to wait? Is it going to get better potentially, or am I just putting off the inevitable?
That makes sense. So if you are in need of knee surgery, what are some of the what can you share with our viewers to tell them, this is what type of surgeon you should be looking for, and the characteristics of that surgeon that you would want to operate on your knee?
Right. I think probably the first thing you have to think about is, am I comfortable with that person? And if you're not, it's not a good mix for either one of you. It's a big deal. Even what we might consider somewhat minor surgery, like an arthroscopic procedure, which is an outpatient type of procedure where we use little cameras and small instruments, we may consider it somewhat minor, but it's not minor when it's being done on you.
Correct.
So regardless of the extent of what that procedure is, you want to be pretty comfortable with that person that's going to do it. And the recommendations they're making, do you trust them? That's number one. I think another thing that I really value in a physician, if I'm going to seek that help, or if I am that physician, is doctor means teacher, literally. And so part of my job is to teach you. I'm not going to make you an orthopedic surgeon in 5 minutes, but I'm sure going to try to help give you a better understanding of what your problem is, what are your options? Because part of my job is to educate you so you can make a good decision for yourself. And it's not always going to be the right answer for every person. So it's not black and white. Medicine's a lot of shades of gray.
Absolutely. Would you say that when your patients do come and see you, are they pretty compliant? Do they, when you tell them that they might need knee surgery or even going to see a physical therapist, do they listen and do what's right, or do they put off the knee surgery?
Well, I think that patient is going to be the same as what you encounter in many other things in life. They're going to be along the whole gamut. Some are going to be very compliant. They completely buy in to what you're selling. Some are going to be more resistant. I guess that's human nature. We can all think of occasions in other different parts of life where we've seen similar things. I think coming back to, if I can educate you better as to why things are important, why that therapy or the way we're going to do things is important, it's a lot easier to accept. It may not be fun. It's work sometimes. It's kind of like if you're a parent. If you just tell your child, do this because I said so, hopefully they still will. But if you take the time to explain this is why, or here's the consequences, or here's what you can get out of it, I think your odds go up that they're actually going to be more compliant and they're going to see it through. And they're going to do better, and you're going to feel better about it.
Absolutely. And you mentioned some of the solutions being injections. Are there certain injections that are better than others, or does that depend on the type of patient and what the problem is with the knee?
It does depend a little bit on what the problem is and what you're trying to get out of that. So most commonly when we say injections, what most people think about is steroids. They say a cortisone injection, and that whole class of anti-inflammatories. And that's really what a steroid does. It's a strong anti-inflammatory effect. We know people use steroids for asthma. Everyone's like, oh yeah, of course. Well, that's an inflammation in the lungs, and the steroids doing it. So it's the same concept. So we take Motrin or these types of medicines to reduce inflammation. This is a stronger effect directed right to the area. So it can be helpful, but it's for more that acute inflammation and trying to reduce that pain. The problem is it's a lot of times not going to be sustained over long periods of time. It may be a temporary fix if you have a fairly advanced arthritis, these things. Sometimes it's part of a solution, getting past a point in your recovery for some injuries. And then there's other types of injections. The active ingredient is called hyaluronic acid, which is part of what our cartilage is made of. And there's a bunch of different companies that make them with some good results with them. This is more for arthritic conditions specifically, and the knee primarily. The appeal of those is when they do work for someone, they work for a much longer duration. The hope is 6 months or more of relief from these. And the other thing that I find really appealing for those versus a steroid is one of the things we worry about with steroids is they may cause softening or weakening or damage with repeated injections. We haven't seen that as being a concern with these types of injections. So as long as they're working for you, it's a great solution that maybe that's where I'm at for now.
And certain age groups, we have our athletes, our high school athletes, our collegiate athletes, and then we have your age group after college.
Right.
That we might go out and play basketball with a friend, hurt our knee, and maybe a little bit reluctant to come and see an orthopedic surgeon. At that point, what are you seeing at that point? A lot of the knee injuries that you may see, is it more ACL repairs or meniscus repairs?
There may be some of the same injuries that you see in that little bit younger population. So you're referring to what we commonly call the weekend warrior.
Right.
And I'm an advocate for it. Be active. You know, it's part of quality of life as well as being a little bit more physical. But because you're only the warrior on the weekend, our ability to recover sometimes isn't as good as we get older. It's the reality of life. And maybe we become a little bit more deconditioned. So some things is, preparing. Sometimes warming up and stretching maybe has a little bit more role as we're a little older than maybe the need was when we're younger. Getting into exercise routines on a regular basis, working on both your flexibility and your strength so that you have a good support around that knee in what you're doing. Be realistic. Sometimes it's realizing that I'm not 20 anymore as much as I want to be. Right. But I'm not saying don't be stubborn about that. Yeah. That can be good. And you want to stay active. And it's realizing that, it's okay to wait a little bit. I can understand you being reluctant, and you don't have to rush to the doctor as soon as something hurts. But when it continues and it's affecting you and it's clearly there, come see me. It doesn't mean surgery. I got a lot of options probably for you. And I think that's where some reluctance is too. It's like, how do I fit this into life? And yeah, sometimes it can be a little bit tough, but don't assume too much.
Well, we certainly appreciate all of your advice and even offering the time frame of when the viewers need to come and see you as well, or an orthopedic surgeon as well. We appreciate your time today, and thank you again for coming.
I appreciate the opportunity, and thank you.
Thank you. Thank you.
For more information, visit mclaren.org/Macomb Ortho.
Thank you very much for watching In Good Health with McLaren Macomb. I'm Aaliyah Flores, and we'll see you next time.
To view this episode again, visit mclaren.org/MacombBlog.